The border crisis and this new immigration policy separating children from their parents. A lot of people are outraged about this, especially anyone who's a parent.
Yeah.
It's hard for us to imagine as parents our kids being separated from us and the impact that it's going to have on these kids.
It's a psychological thing. It's science. Actually, Dr. Donna was going to come in this morning. We were going to talk about pool safety, but kind of shifting gears. We're going to talk about that later. But we're just really interested this morning, your point of view here, Doc. You've been talking about the last 24 hours has been tough for you. Why?
Well, you know, any pediatrician that sees children in crisis situations, whether it's a hurricane in Houston or an earthquake in Haiti, is going to be concerned about the welfare of the children. And so what we've got now, based on this new policy, is an Amber Alert for the country. We all get upset, even if we're in a store and we see a child walk up to us alone, crying, "What's wrong? Where's my mommy? I can't find." The entire store is now on alert to find this child's mother. So if you take a child from the very beginning of their life, the two things that they need and deserve and get are physical safety and emotional security. And what we've done by this conspiracy is we've said we're going to take that away from you. And the social, mental, physical, and I would say ongoing health of these youngsters, even cognitive health, is going to be affected for many years, and the parents. We can't understand. We have to understand that the parents are also going to be depressed for years about this, even if they do reunite with their kids.
What would you say if there are some people who say, well, this is just a temporary situation, these babies and toddlers and children are being separated. Let's say it's just temporarily. What kind of impact does that have? Lasting impact will that have, even if children are separated temporarily from their parents, where the adults who are supposedly supervising them aren't even allowed to touch them?
Well, again, the science is clear. This has an ongoing effect of the idea that they are not going to be safe. What constitutes safety? We know that if kids are separated, even for a short period of time, they never want to leave their mother. They will follow their mother around. I've been a pediatrician for 40 years, and I've seen this many times when parents have been gone or gone overseas. We see fathers reunited with their children after being overseas extended periods of time in the military, or going to Alaska to fish for 3 or 4 months. Again, the fact that these youngsters are missing their security blankets, basically, means that they're going to be affected, even if it's short term, because they are unsure whether they're going to see their parents or not.
So what are the side effects then? What are the ramifications that we might see?
Well, again, we're seeing youngsters that are going to have depression. They're going to have difficulty focusing on studies. They're going to have difficulty ongoing with trust issues, trusting adults, trusting even people of authority, because, again, people of authority have separated them from their parents. They have faced such adverse circumstances, being how they've gotten to the border after 2, 3, 4, 5, 6 months, moving through countries, trying to avoid violence, leaving violence behind. So they've already been affected. This is just adding to that. And the president is on record in his State of the Union address saying we are a compassionate nation. It's time for us to act like that.
Thank you, Dr. Don. We really appreciate it. Back with weather and traffic after this.